Good afternoon, everybody. Thank you for being here with us today. This is our community conversation regarding the future of our Hornsby Bend Health and Wellness Center, and we really appreciate you, first of all, taking time to join us today, but also being flexible with us last week when we had to reschedule this community conversation due to inclement weather and power and water outages. So we really appreciate you guys sticking with us and rejoining us today. My name is Ted Burton. I'm Vice President of Communications at Central Health. And before we get started, just a couple of virtual house rules for today's conversation. First of all, we want to make sure everybody has a chance to participate any way you can, whether you've joined us through Ring Central or if you are on the telephone. We will keep everybody muted on Ring Central until about noon, when we will open up the conversation for questions. Maybe sooner if we move quicker than that. If you're joining us by video, please feel free to drop questions in the chat box. It's on the right of my screen, should be on the right of yours as well. And we will try to answer those questions as we go. And then if you are on the phone, just hold your questions until we're able to open up the phone line. To join and ask a question by phone, you unmute your line by pressing *6, and that unmutes you. In the spirit of inclusivity, we would like to make sure that everybody has a chance to ask a question. So just, if you don't mind, one comment or one question at a time, and then we can circle back around if there is time for folks to ask more than one. And then we'll use a mute button throughout the meeting and during the Q&A portion, just to make sure, if we need to make sure one person at a time, that usually isn't an issue, but we do have that if we need to. And then during the Q&A portion, you can raise your hand if you have a question, and we can unmute your line as well. So there's several options and ways you can join the conversation. If you're joining via Facebook Live, which a lot of people do, we will try to address your questions as well. And then we do capture the questions that are asked, and we respond to them and share them with those of you who've joined today. So everybody will have access to that as well. Today, we want to share with you information about the progress on our Hornsby Bend Health and Wellness Center, the proposed list of services, the site concept and plan, and then how you and your neighbors can remain informed and engaged throughout the life of this project. And we have several presenters today that will help us present about this project. First is Stephanie McDonald. She's the Vice President of Enterprise Coordination and Alignment. We have representatives from BSA Life Structures, that is our architecture and engineering firm. And I'd also like to welcome the President and CEO of Central Health, who's also here with us today, Mike Eastland. And now, Stephanie, I'm going to hand the virtual mic over to you to begin our presentation. Thank you, everybody.
Thank you, Ted, and thank you to the communications and community engagement team at Central Health, as well as all of our consultants and the community for being here. We're really excited, and I don't think I can express on behalf of the Central Health team how excited we are to show you some really amazing designs that are coming along for the Hornsby Bend Health and Wellness Center. I do want to let y'all know that on January 27th of this year, the Central Health Board of Managers approved advancing the project plans for 3 new sites, including the Hornsby Bend Health and Wellness Center. If you'll go to the next slide for me, please. Thank you. One of the things that the board asked us to do as we developed these plans was make sure that we went back to the data and understood the needs of the community and the patients that we are serving in the area. We at Central Health have a mission to serve those under 200% of the federal poverty level and really make sure that there's access to healthcare across a continuum of services. We have asked our clinical operator partner, Community Care, to work with us in developing the clinical services for the site. And all of this is still in progress. But if we went back and looked at the data, we did see some really interesting things that are unique to the Hornsby Bend community. One is, even though it is a small population size, there is a high level of utilization already in the Central Health system. And that includes using community care clinics at Southeast Health and Wellness Center and North Central. Given the geographic isolation of Hornsby Bend, We really know that there is a need to develop a health and wellness center that is comprehensive, that meets more than maybe just what you used to think of as the clinical medical needs in the community, but also those health indicators and wellness indicators that we call the social determinants of health. And so we're looking at the Health and Wellness Center in Hornsby Bend maybe differently than some of the other more traditional clinic sites where there would be, clinical services, maybe some social work services available to patients. What we are seeing here would be, inclusive of having other provider partners that would allow us to serve the wellness needs in the community. And I think you'll see some exciting concepts for additional wellness services on site. The community in Hornsby Bend, primarily Latino, and like I said, they are high utilizers. So we know that there are definite needs in the community for access to healthcare. We have been operating for about a year. I know that it's been very difficult. It opened right at the beginning of the COVID pandemic, and in a temporary health and wellness center located on 100 Bend Road on the ESD property. We're really excited about working with the community to create something that really is resonant of the community and knits the community together. And we want to see something here that everybody feels welcome at. The next slide, please. What we do know is that there needs to be more investment across many different services for this area. But we want to concentrate on the clinical medical services. That would be comprehensive primary care. When I say comprehensive primary care, that means women, families, children. There will be providers here who can do a whole host of medical care for the community. Integrated behavioral health. This means that when you're coming in for your doctor's appointment, maybe you're coming in for a well woman exam, and you exhibit or express need to have potentially some behavioral or mental health counseling, that can be done on site, potentially even during your appointment. And this really incorporates technology and allows us to provide more services out in the Hornsby Bend community through technology. And with that, we are also looking forward to planning additional specialty care through telehealth, and allowing us to take advantage of the community care network and the providers that are available, but physically cannot drive every day to each of the sites and be present at each of the sites. And it allows us to really better utilize the resources of community care and the provider network. I want to let people know that if you don't know where the site is, you're going to get to see a lot more about it. Central Health purchased property at Gilbert and Sandifer Streets across the street from Daly Middle School, and it is adjacent to a residential neighborhood. And we want to be really good neighbors and stewards, and I want to just make sure we share that up front. We're doing a lot of thoughtful planning. I think the work that we were doing was further kind of spurred by the storm and the impact to the Hornsby Bend community. I know that many of the Hornsby Bend residents were without power for well over a week. And I think this is something that we're really thinking about and how we can serve as a resiliency hub in these situations in the future. And I think you'll see some more planning in the presentation about how we are thinking about serving the community in a storm or a pandemic situation. So with that, I'd like to turn it over to the design team and thank them for all their hard work, and the presentation they're about to show you is really exciting. And I believe Kelly Halls from BSA will be on taking the virtual mic next. Kelly?
And Stephanie, it looks like maybe you've not yet joined us. So Kelly, if you're out there, let me know. But if that's the case, then I can go ahead and take over.
Great.
Rachel, you want to? Sure. All right. So we're here from BSA to present just design progress for the Hornsby Bend Health and Wellness Center, like Stephanie said. Next slide, please. Just a little bit of background on BSA and who we are. We are a design firm that has both architecture, engineering, and planning. We've been around for 45 years, since 1975. We've been working on healthcare facilities, higher ed, and technology and labs mostly. We have about 180 employees that are spread over 7 different offices nationwide. The local group here in Austin has about 12 employees. And then we specialize, one of our specialties is healthcare. We do about 3 million square feet of medical space annually throughout all of our offices. Next slide, please. Like I said, we really focus on the 3 areas of healing, learning, and discovery. So we consider ourselves to be experts in all 3 of those, but today we're obviously going to be talking mostly about the healing sector. And our company motto is we create inspired solutions that improve lives. The improving lives is a really important part to us. We take each project very seriously, and we like to connect to the people, including those around in the community. So this project really aligns well with our company vision and what we try to do with each project. Just to introduce the team, so obviously you know me. My name is Alan Kitchings. I'm an architect, and I'm the project manager and really the lead design architect for the project. Kelly Halls, who may join us shortly, is an architect as well and a principal here in our firm. A gentleman named Phil Cartwright is an architect who's a facilities planner and really has helped us with the front end. He comes in early in a project and helps ask really good questions as far as programming for the building, and really figures out what spaces need to go in the building with us. And then Aaron Fogarty is our lead interior designer. So we're going to jump into the project overview and just look at some of the details of that next. As Stephanie mentioned, the project site is in Hornsby Bend. As you know, it's in eastern Travis County, located near State Highway 130 and 969, which is also Weberville Road. It's about 10 miles to Austin Bergstrom Airport and 12 miles to downtown Austin. Just to get kind of a zoomed in look at the site, as mentioned, there's Daly Middle School that's across the street, undeveloped land mostly to the south and the west of our site, and then residential neighborhoods that really kind of align the east part of the site. The blue area is our project site. That's about 10 acres total, and as we look at the plans, we're really taking over about 3 acres of that. All right, so site features. Some of the things as we've started laying out the building and the site plan, we've got a north-facing entry, which that plays into some of the architectural design. Facing north is a good thing as far as glazing goes, windows, because we're not getting a lot of solar gain from the south and east and west facing parts of the building. We do have drives that go through the site, connecting the parking lots. And a big focal piece there in the front is a drive-up canopy where patients can be dropped off and people can wait outside of the main entrance there. We've got, visitor and patient parking in the front. It seems to be, sprawled out a little bit across the front. Some convenient spaces there in the very front, and then some over to the side. Connecting through with the drive. And then we've got a service drive and a service area towards the back of the building where we could have some dedicated staff parking spaces there. We'll look a little bit more at the site amenities and the different features on the site, but we do have a number of different amenity zones that have been identified, and we'll get into those in the coming slides. All right, so site design concepts, just to talk a little bit about some of the potential design concepts and items that could be seen on the site. Next slide, please. So some of the things that we've taken into consideration for this site would be a variety of different activities and things that really lend themselves to wellness outside of a building. That includes active play areas, community gardens and orchards, fitness trails and outdoor walking areas, outdoor gaming for play areas outside the building, native plantings and bioswales, which are really just natural features along the site, and then outdoor seating for not only waiting for the clinic, but also just places where people can gather, things of that nature. And this is just a look at our conceptual site plan. So the items that we looked at on the last slide, you can see them in design here. Here, the building kind of sits in the center of the site there. The brownish gray areas are obviously the drives and the parking. So at the main canopy there, you can see there's a covered patient pickup drop-off area just right outside the front door, with some outdoor seating that can be used for waiting or for small gatherings or discussions. The bioswales and for rainwater drainage, those are a feature that's required on the site just to drain water away from the building. We hope to align those with some native plantings to really make it feel like it's not so much a utility on the site, but really a natural feature. Some active play areas closer to the building where we could have playground equipment, outdoor gaming zones and gyms. And then back towards the back, you can see the service and staff parking area. We envision a trash dumpster, and that's where most of the deliveries and service to the building would occur. And then some potential fitness trails. The site does have quite a few trees on it. So as the building kind of takes shape, there's some potential to add in some trails and really take advantage of the nature that's around us. I'm going to show a few more views here of just different angles of the site. This is kind of looking from the northeast side back at the building. Going to show you the parking and the drives. This is a view down at ground level coming into the site that you'd see as you're driving up, and the patient canopy there in the front of the building. And then this is a view from up above the building, looking at that main canopy. You can see there's a feature wall that has a space that we can use for outdoor seating, and you can see the trees surrounding the building with some plots over to the side for the community gardens, and then the potential play areas just outside of the building. Okay, so that covers the site. Now we're going to move on to the building design concepts. Next slide, please. So the building really serves a couple of different functions, or many different functions, but it's been separated really into the main focus of the building is the clinical piece. And then there's obviously some other non-clinical functions happening there as well. You can see on the clinical side, it's really kind of the blue and purple shaded areas. We've got 6 exam rooms, 2 flexible rooms, and a procedure room to be used for seeing and treating patients. There's a centralized care team station there in the middle. That's the purple piece. And then support spaces such as a blood draw lab, meds and nutrition storage room, and a staff break room for those nursing staff, lockers and toilet towards the back. And then other support spaces like a storage room, clean supply, just the different rooms that would be required for service and the mechanical functions of the building are located towards the back. That's kind of the gray area that you see there. On the, I guess the one other piece that I want to point out is the pharmacy. We've got that pushed up into the front of the building to allow it easy access from the public. That will serve the needs of the clinic and allow people to come and get their meds from that area. On the non-clinical side, which is mostly there on the right, the yellow and gray area, we've got a large flexible community room that can be used for a number of different functions for the community and for the clinic itself. It should be big and open and very flexible to allow for different uses. There's a number of different waiting and seating areas out in the public lobby that should be open to the public could be used for small gatherings, maybe after hours or for different functions. And then there's community workstations right outside the waiting room on the left. Those could be workstations maybe with computers or something open to the public for use. A public toilet towards the front near the vestibule, and then storage for wheelchairs out in the front as well. Then over on the right, there are a number of offices. There's 5 offices that can be used for different functions. I think the intent of some of those are really community outreach functions, as far as maybe helping with business-related functions or tax preparation or things like that. So that should be very flexible, not necessarily dedicated to the staff of the clinic itself, but open to the public use as well. Next slide, please. And then as far as the architectural design concepts go, you know, as we put the building together, we try to focus on some of the architecture itself. There's obviously a separation of public and private areas. This layout lends itself to be able to secure that clinic from the rest of the building, so that there's a nice separation there. One of our focuses is to maximize natural daylighting. So as we look at other images of the building and the exteriors, you'll see that we've done some things to make sure that we get a lot of daylight into the building, including clear story windows, which are the windows that are up high near the roof level to bring light into the spaces such as the public lobby and back into the core of the building near the care team station. Views and connection to nature, we've made a point to provide windows wherever possible to be able, you know, as people are sitting in the exam rooms, to be able to look out and see the gardens on the grounds, or to see some kind of view, because that plays into wellness as well. And then connection to exterior site features. As we look at some of the other drawings and renderings, you'll see that we've tried to locate parts of the building where it makes sense to connect those out to some of those site amenities. There is a focus of sustainable design with the building. So all of the fixtures will be very energy efficient as far as lighting and plumbing and HVAC, the pieces that really make the building work. And then there's also a focus on sustainable materials and design strategies. We'll talk a little bit more about materials, but trying where possible to use green and sustainable materials as much as we can. And now to take a look at the building exterior, just to give you a view of how the design is taking shape so far. We've tried to use a palette of warm and natural materials around the building. We want to be good neighbors for the residential and the different people who live in the area. So we want this to blend in and not be something that blends in and looks natural in its setting. Like I've mentioned, we've tried to put a focus on natural daylight. So some of the windows that you can see up high and the large window walls that you can see in the front of the building there in the north building elevation, we've tried to maximize windows as much as possible to get a lot of daylight into the space. We've used the large windows there, and then we've used punched windows, the window openings around the sides of the building, to allow some light and connection to nature into those exam rooms, into the offices that are along the exteriors. One of the design features I want to point out is the large sloping roof. It is a metal roof that we plan to try to utilize. As we looked at before, there's some community garden plots planned for the area. So the intent here is to try to utilize that roof and collect rainwater, divert it to a cistern where that could be used as irrigation water on the site. And then obviously in the front, you can see the drive-up canopy. That would be a metal structure with some accent materials included there. And then near that canopy, there's planned an outdoor seating and waiting area just outside the front door. Okay, next slide, please. This is a look at the other sides of the building. Similar palette of materials and architectural language there. One thing I want to point out is we've tried to utilize kind of a lighter material for our field. It's kind of our canvas color. And then we've tried to plan in some opportunities for just deeper colors and texture, things like that with our accent material. So the brown color that you can see kind of surrounding the windows is more of an accent material there. And then from the east side that you can see, we've got those clear story windows that are up at the roof level that will allow light down into the building. Next slide, please. And then to talk a little bit about our interior design inspiration, we try to take inspiration from the local Austin area. And so you can see here, there's a photo of Lady Bird Lake downtown. A lot of the cool blues and greens and cool colors that you can see in the natural surroundings. That's part of our color palette that we started with. And then obviously with some other vibrant colors from the sunsets and different active areas and features around Austin. We've got a few other just more vibrant colors to make a really nice palette it's not overpowering, but connected to nature and should feel soothing for the folks that will be visiting this clinic. And then just to take a look at what that interior finish palette may look like, you can see our color scheme there at the bottom. We've tried to bring in colors that are, we've tried to bring in other materials that are tied to nature as well. So there's a real mix of natural materials and some of the things that we're looking at doing as far as our interior design goes. We want obviously the nature inspired materials and colors. Flooring changes, subtle changes in the flooring that can be used for wayfinding through the building, kind of designate areas and separate those. Natural light, I know I've said that a lot today, but that's a big focus for us, bringing in as much light as possible to enhance the patient experience. And the materials that are durable and cleanable, yet warm and welcoming. It's a healthcare facility, obviously, so there's a level of cleanability and practicality that has to be there, but we want these to feel warm and welcoming, so it's not so institutional and feels comfortable for the people who come here for treatments. And I think really that's all we've got presented. I see that Kelly has joined us there, so Kelly Halls from BSA is also with us. So I guess I can turn it back over to Stephanie or Yvonne.
I think next is Yvonne to talk about our community engagement strategies.
Hi, everyone. Good afternoon. Now it's noon. Yes, Yvonne Davila, Director of Communications and Community Engagement at Central Health. We at Central Health use a systematic approach to engage with community members, including our medical access program members, and we engage with residents and MAP members via community conversations, online. Sorry, can we go to the next slide, please? You'll see on the left some of the tactics that we utilize to engage with community members. So one-on-one interviews, online and paper surveys, community conversations. We have community advisory committees, and then we also schedule meetings with neighborhood groups. And we do have a community advisory committee in Hornsby Bend, and you'll see the dates on the right-hand side. Today's community conversation is also on there, March 4th, and then we plan to have a second one to share with you how we're implementing some of the feedback that we're gathering during this feedback gathering phase that you see that started February 22nd and will go through April 5th. We will post a community engagement report for this project on our website, and we will share that link with you here in a second. And we'll share both via Facebook Live, and we will also share it here on the chat box. But people can go to our website to respond, not only to learn more about the project, but also to respond to the online survey. And I'm going to first add the online survey to the chat box, and that's where you can, excuse me, that's where you can give us your feedback. And the feedback that we're looking for is in terms of amenities. What things are important for community members to see either inside the building or outside the building. And you'll see what we mean and all the options. And there's also opportunity to add other options that are not listed on there. And then we will share the feedback that we gathered via the community engagement report that we will be posting on our website on April 7th. So with that, please, if you can please go to the next slide. We do encourage everybody here present to stay informed and engaged in this project. That is the website address to visit. In there, you'll see you'll see a lot of information on the background of the project. You'll see information about the demographics that were shared earlier, and then you'll also see progress on this project, including timelines and any information that we share via press releases. It's all posted on that website. There will be more opportunities to engage in this project, to participate. We will post on that website as well. And then, of course, we'll continue to keep everybody who attended posted via email. We do send regular email updates to people who have expressed an interest in this project. With that, I am going to turn it back over to Ted.
Thanks, Yvonne, and thanks, Alan and Stephanie. We appreciate the presentation. We do want to open it up for questions. Before we do that, I know our President and CEO, Mike Giesland, is here, and I wanted to give Mike an opportunity to say a few words if he would like, and then we will jump in and answer some of your questions. Mike, are you there? There you are.
Yes, I am. Thank you. So again, I want to thank everybody, the teams, both our consulting partners and design partners, but also staff and community members and leaders for helping us get to this point. I mean, this is a great day to be able to see these pictures, and it starts to take what is a piece of land and bring some reality to it. So we're excited about this work. Second thing is I wanted to emphasize what Yvonne Davila has just shown you, really staying engaged and helping us be informed as we go throughout this process and understanding, from an equity standpoint, what does it need to look and feel like when you walk in, whether you're there for an appointment to see a provider or you're there for a community meeting to talk about how we improve the health of the community. What does that need to look and feel like? And so we want it to be a good experience for all those that walk through the doors or walk the grounds. So do provide us that feedback. Thank you.
Thank you, Mike. So please feel free to raise your hand or put a question in the chat. And I don't know if we have anybody on the phone who may have questions. If not, I'm going to jump in and go back to my old days of being a reporter and ask some questions of my own. So anybody have any questions in our chat, or do we have any coming through on Facebook Live? There we go. And this was going to be my first question. So thank you, Jennifer. Yes, a question is about the timeline. When do we hope to start construction? And is there a construction delivery method? That was not part of my question. So I don't know who wants to take that one, Rachel or Stephanie?
Ted, I'm happy to do it. So first of all, we have a preliminary schedule. We are in schematic design. Things got a little bit delayed because of, I think I've heard it referred to as snowvid or the snow apocalypse. I think we are a little bit behind there. We also are fighting the COVID-19 pandemic, and our clinical operator is very, very busy trying to get people vaccinated right now and still providing medical care throughout our community. So I believe that we are wrapping up schematic design, and we'll have more defined timelines as the project progresses. We do hope to get our site plan approved. That does take some time, even out here in the ETJ. So I just want to be very cautious and let everyone know that we have some ambitious goals to break ground this year. Hopefully before the end of the fiscal year, but know that there's a lot that we're swimming upstream against. And I think this project, though, will be the first. I think it's the furthest along and the most likely to meet that goal. On the delivery method, I believe as of this week, hot off the press, we will likely go with a general contractor and wait until the design is finished and to bid that out.
Thank you. And then the construction manager at risk. I'm not exactly sure what that means. Does it mean, do we have a risk manager for the construction project?
It's a delivery method, so I think
okay. Sorry, I didn't understand that question.
That's okay. So we've chosen
Anybody?
another delivery method.
Gotcha. Any other questions? And Anais, my trusted colleagues are behind the scenes as well. Do we have any on the phone or any on Facebook?
Nothing
Did
on
I do?
Facebook, but go ahead, Yvonne.
Go ahead.
So,
Anais, or
no, go ahead, Anais.
That was it. There's nothing on Facebook yet.
thank you, Yvonne.
Yeah, there's a private message that they're choosing to stay anonymous, but they said they're getting chills. This is what our community needs and has been waiting for. It's been long enough. And so I just wanted to share that with everyone. Thank you for your comment.
I was going to say, listening to Alan present about the concept designs and color palettes, and it both inspiring and almost makes me want to take a nap because it's so soothing and calming. So I'm really excited to see what this might look like. And that is not a criticism, that is a compliment. But
There's no napping in Central Health.
I love the way you paint a picture of what this could look like, and I can't wait to for our community to weigh in as well to make sure that this is a facility that meets their vision and their dreams of what it could be like. There is a question from Dr. Moody. What elements of wellness program inside this space will be available? And he's referring to some of the office and conference room space. And Stephanie, I think you mentioned this or touched on this in the beginning, but a wellness program will be an important part of this center. Do you want to pick that one up?
Absolutely. I think we are still working through that. Part of the survey is to try to help us identify needs in the community. We want to make sure that what we are doing in Hornsby Bend really is reflective of the community, culturally competent, but also really meeting the hard needs that we know many of the residents face. With that said, we do have a model for this, and we have a really, I think, great example in the Southeast Health and Wellness Center, and we are building upon that for Northeast Health Resource Center, which is going to open in the next few weeks in the Colony Park community. We have developed relationships, and I say we, but a lot of hard work from Melissa Cepeda and Elizabeth Marrero, who has been really leading us at the Southeast Health and Wellness Center. So there's, plans to work with partners. We don't do this on our own, and these are services that we primarily at Central Health are not equipped to provide. SNAP assistance, and, Central Texas Food Bank connection, diaper bank potentially. We are working with a couple of groups in Northeast Health Resource Center that are related to maternal health and making sure that that the mamas are getting care outside of a pregnancy. We, of course, will have eligibility and enrollment for the Central Health covered programs here. We envision, and we've had some collaborative conversations. Unfortunately, a lot of our nonprofit partners are having a real struggle during the pandemic, but are there other wellness and recreation activities? We, approached just a conversation to see where, for example, the YMCA is in their planning process. We're also looking at some things, we don't know all the community partners. So we're looking for ways that we can collaborate with the community. We know that there are a number of seniors in the area, maybe programs specific to seniors. The community workstations that I believe Alan mentioned, what we're seeing is that a lot of times these services are available all the time, but they're available only through the internet. So we would like to have this resource that people could come in and access services, basic needs assistance to Travis County, for example. And if we can find a way, we'd like to see, Social Security disability applications, potentially housing assistance, rental assistance. And I think the list is endless. The opportunities are vast, but a lot of this is going to be just partnerships as we develop as this site comes online.
Thank you. Thank you, Stephanie. I know our community health workers, we had launched just before the pandemic our way to wellness workshops. And so I know we're eager to take advantage of the community space to do more way to wellness programming for residents, MAP members, people in the community. We do have another question from Diana. She's just asking, will there be any plans to address the lack of roads and really access to accommodate a growing community? And I don't know who might be best to talk about that. There is definitely a challenge there with access.
What I will do is I will commit to asking Mike Gieselin to make sure that our elected officials, our county officials are aware of the concerns and the issues in the community. And especially, we know that this is an area slated for future growth, and we'll be at the table with you.
Yeah, and actually, this at the risk of maybe getting out ahead of really what I understand, about community infrastructure development, is that's absolutely something that we have to engage in. Not just because there's a piece of property out there, but because when you think about health and wellness and social determinants of health and how a community develops in a time of rapid growth, that's important to us as friends and neighbors out there. And so, and I would ask the design firm, I think you all you were very deliberate about this, and that, recognizing that there's 2 road frontages on this piece of property, but having ingress and egress to the property. And Rachel, you had put together, I think you put a slide up there or 2 that showed this, but the point being is that, we understand the infrastructure issues, and we want to make it easy to get into and out of this piece of property, but also be able to use this space that we have for events out there. I mean, the one thing, and I'm kind of drifting off into another subject, I know, but one thing we figured out in these pandemics is or even, during what is in the future going to be cold, flu, and corona season, the need to be able to have drive-through and people to safely access, have ingress and egress from the building in a way that, is not stressful, and is, recognizing their convenience too as well. So there's some things that I'll give kudos to the folks for designing into this piece of property. But back out to the larger community issue, and it's not just roads, it's also water.
Right.
I mean, we could go on other infrastructure issues.
And we've heard that from our advisory committee members too,
Yep.
Mike, about concerns about water and making sure there's access to safe, clean water for the facility. We have a question from somebody regarding who should they contact regarding materials that might be displayed. I think we might be a little bit early, ahead of ourselves, trying to decide what might be displayed there, but who would be the contact, Rachel? Would that be you? Or I know it's down the line, sorry, I'm reading our chat. Okay, so Yvonne, you handled that. They can contact communications, but I think there will be a point when we'll have those conversations with residents there about what might go inside the space, and anything from art, displays, that type of thing. So that's a good question. Somebody's definitely thinking ahead.
And Ted, I wanted to also mention that at any given point, if anybody has any thoughts as to any neighborhood group that we should be working with to let people know about the progress of this project and let people know about ways to plug in and get involved, feel free to contact us at communications@centralhealth.net.
Thank you. Stephanie?
And I just want to add that today you saw some renderings, you saw some great design, you even saw some floor plans. And I just want to be very clear with the community that these are still in progress. Don't take what you see today and share it and say this is what's going to be. We're absolutely still working with the designers, our clinical operator, as well as, within the Central Health team to make sure that we're creating and designing the best and most efficient space for the community and our operator.
So the sunset palette of orange could change.
That is less, I just don't want people to edit to the floor plan as it is. We've already made some modifications from what has been shown in this presentation. If you like the orange, we can definitely take a vote.
I'm always in favor of orange. Thank you. That's good. Any other questions from Facebook, Anais or Anastasia, or anybody else in the group that's with us, either or on the phone, have any questions?
Nothing else on Facebook, Ted, on this end.
I have a couple of questions, and I think Stephanie or Rachel may be to answer. One is, how many people do you expect this center to serve, at least, initially? Can you talk about that based on our demographic report?
Yeah, that's a really difficult question to answer. We know, right now who's utilizing the clinic at the ESD property on Hunters Bend Road. We also know the number of people who are enrolled in Central Health covered programs in the area. Just because you are enrolled in, say, the medical access program, though, doesn't mean that you're going to choose this site and transfer your care there when it's up and running. We know there's a lot of reasons why provider choice, for example, in a relationship with a provider that exists prior to this clinic. Some of the services that you want to have that are going to be available or are already available, as for example, the Southeast Health and Wellness Center or North Central, will not likely be here. And so you may need to continue to go to those sites if you need to have an in-person, for example, visit with a medical provider that is only there for limited hours. We have a number of specialists that serve in very limited hours to our patient population. But we also know that community care will welcome anybody who walks in their doors. And regardless of being insured or uninsured, we see that there is need in this community, and we know that it's a growing community. And as this community grows, we want to be there and be responsive to the healthcare needs in the community. So I think that, 2 providers, but we actually have a lot of flexibility within that. And that may not be how the clinical operator chooses to start on day one. I think there's a lot of space to kind of grow into this clinic. And we really want to see more utilization from the residents and making sure that they feel like this is a place that they trust to get quality healthcare. So I think a lot of it, is to come.
Thank you. Anybody else have any questions? Any final thoughts from our presenters today? We don't necessarily have to go until 12:30. We've answered all the questions. That's a good thing. And of course, people who are on the call are always welcome to reach out to us at communications@centralhealth.net, and we will quickly and respond the best way we possibly can. Anybody? Okay, I'm gonna one last call for questions, and otherwise we're gonna wrap it up. And thank you everybody for spending what might be your lunch hour with us, talking about this really exciting project. I know this was an interesting one for us. As Stephanie mentioned, we had a grand opening for our temporary clinic, and literally, I think a week or 2 later, the pandemic hit, and that clinic had to temporarily close so that community care could reallocate staff and also resources like personal protective equipment when there was a dire shortage. So it kind of got off to a really great start, and then it stopped, and now it's back in action again. And I know utilization has increased at that location, which just shows us that there's a real need. And we are very grateful for our community partners that are on this call. Some are here, and I know some aren't, but this couldn't happen without them. So without their input and guidance, we are deeply grateful for that. And anyone has any final thoughts, please share. And if not, we will just wish everybody a great afternoon. Okay. Bye,
Thank you,
everybody.
everyone.
Thank you so much.
Good job.
Thank you all.